Very good morning, all of you. I'm Shasini postgraduate student at the Faculty of Education Studies, University of Putra, Malaysia. Today, I'm here to present my findings on feasibility of distance monitoring on sedentary time and physical activity among Sri Lankan adolescents. This is my content. Introduction. As you know, currently in the Western society, most of the children have access to at least one device, such as mobile phones, tablets, and the computers. So this leads to sedentary behaviors. Especially with this COVID-19 pandemic, physical inactivity and sedentary behaviors are rapidly increased. And also, children are unable to engage in physical activities outside of the home. Therefore, we identified distance monitoring could be a good mechanism to monitor them. Distance monitoring refers to physical activity, keeping daily activity records on physical activities or keeping track of what we do on our regular day-to-day life. I would like to highlight my problem statement in 6 points. The first one, moderate to vigorous physical activity and restricting sedentary behaviors are both recognized independent risk factors for poor health outcomes in children and adolescents around the world. Therefore, Sri Lanka also faces similar circumstances where physically inactive citizens are increased with the COVID-19 pandemic. And also, earlier students were used to do physical activities at school, but with this COVID-19, they don't have any access to do physical activities and teachers cannot monitor them. So in my fourth point, technological disrupted adolescents engage too much of gadget phones and this leads to disrupt of their studies and sleeping time. Especially with the adolescent parents in Sri Lanka, they expect high grades from the students and this resulted in the sedentary behaviors. So finally, government concerned about way to monitor physical activity and curb sedentary behaviors, especially with the COVID-19 pandemic hit the world. So in my research objective, it leads to main research objective and 3 research questions. The main research objective to examine the feasibility of distance monitoring concept on sedentary time and physical activity level of Sri Lankan adolescents. The research questions are: want to find out the current status of sedentary time and physical activity level, and then want to find out the effectiveness of the distance monitoring on sedentary time and physical activity level, and finally, what is the relationship between the physical activity level, sedentary time, sleep behaviors, and BMI? Methodology. This research conducted with the mixed method approach. Both inductive and deductive approaches were incorporated. Multi-phase sampling method was used to finalize the sampling, and as the data analysis, descriptive statistics, inferential statistics, and thematic analysis were used. Under the mixed method approach, we use sequential explanatory design to one group pretest and post-test design lead to focus group interviews. This is my sampling technique. We use 347 students with the quantitative analysis, and for the qualitative analysis, 10 students, 10 physical education teachers, and 10 parents. Data collection procedure we conduct with the questionnaire survey and the focus group interviews. So under the questionnaire survey, we use 3 standardized questionnaires to measure the physical activities, sedentary behaviors, and the sleep behaviors. For the focus group interviews, especially we use 3 codes. From these 3 codes, we want to highlight about the distance monitoring concept and the compliance for distance monitoring concept. This is our intervention model. We conduct the study 2 months of period. Data analysis. For the data analysis, main outcome was to assess the feasibility. Therefore, we used recruitment and retention more than 70%, and the treatment fertility of more than 80%. For the quantitative analysis, descriptive statistics used to measure the sedentary time and sleep disturbance, effectiveness of the program measured by the Wilcoxon sign rank test, correlationship between sedentary time and subcategories were measured using the Spearman-Rowe test, and the relationship between physical activity level, sedentary time, BMI, and sleep disturbance were done using Pearson correlation test. Thematic analysis use 6 main steps: familiarizing the data, generalizing initial codes, searching for themes, reviewing themes, defining and naming themes, and finally producing the report. Results. Feasibility of distance monitoring program refers retention rate at 80% and the treatment fertility to physical activity sessions of 20 minutes per week planned. Out of the total of 60 planned sessions in 8 weeks, 87% were successfully held as scheduled. Out of the 2 could not be completed due to the COVID-19 pandemic. Status of the physical activity after the program mentioned that the p-value is less than 0.005, so it means there is a significant improvement in the physical activity level. And also sedentary time also reduced after this distance monitoring program. The correlation between sedentary time and subcategories during the weekdays and the weekends especially shows education time highly correlated with the sedentary time during the weekdays, and the cultural time highly correlated with the sedentary time during the weekends. And the relationship between physical activity level, sedentary time, BMI, and sleep disturbance, it shows there is no relationship between the physical activity level, sedentary time, BMI, and the sleep disturbance. However, sedentary time was positively related with BMI and sleep disturbance. Thematic analysis. So especially with the students, they examine that there is a even chance to accept this distance monitoring concept with the Sri Lankan adolescents, especially the technology and the unrewarding system. And also they mentioned this would be a more unrealistic concept. And also physical education teachers mentioned this also have an even chance to accept by students with the monitoring mechanism and the unrewarding system. Especially they highlighted if there is a rewarding system, they may more actively participate for this type of studies. And also parents highlighted this would be a more impractical concept. Discussion. So the status of physical activity level of the Sri Lankan adolescents were in moderate level, and the sedentary behaviors also high. And also after this 2 months of distance monitoring program, it was positively effect for the adolescent sedentary behaviors. And also there's no positive relationship between the physical activity level, sedentary time, and BMI. Education and cultural activities were highly correlated with the weekdays and weekends. In conclusion, to curb the COVID-19 pandemic, so we want to highlight about the short-term changes in physical activity and sedentary behaviors, and also need to imply different kind of mechanism individual and population level, and also findings point toward the reduced sedentary behaviors by engaging physical activity at home will be promote their health behaviors. So in suggestions, so we can use dietary patterns to this type of research, and also we can use different type of monitoring mechanism, and also as a government we can build policy and regulations. So I would like to give my thanks for my main research supervisor Professor Thank you Kamaladeen and my co-supervisor So Kim Jio for giving their immense support to complete this study. Thank you.